Hello, everyone, and thank you for joining today. We're going to provide an overview of the ePREP portal, the electronic provider revalidation enrollment portal. A few housekeeping items before we begin. Please note that this meeting is being recorded. All attendees will be placed on mute during the presentation. If you have questions, please type your questions in the question bar, and anything we cannot answer, the state will post to its website. My name is Tracy Bryant. I'm the Provider Service Manager for Automated Health Systems. And joining me today is Alan Colton from Digital Harbor. Alan, would you like to introduce yourself?
Hi, everyone. This is Alan Colton, and I'm the product manager for the ePREP portal and enrollment tool on the back end for the state. And Digital Harbor is the one that has supplied the technology for ePREP.
Thank you, Alan. So we have a wealth of information to get through today. And for the agenda, I will be discussing the provider rollout, the implementation timeline used to launch the product. Alan will cover 3 key concepts and terminology that you'll hear throughout the presentation. I'll also discuss the sign-up and messaging functions within the portal, in addition to the My Tools and user administration functions in ePREP. Alan will cover how to submit applications as well as provider accounts. So here's a list of the implementation timeline. ePREP Phase 1 is going on currently, so we will launch the product December 2017. It includes most solo practitioners, rendering providers, and group practice provider types. So nurse practitioners, physicians, and social workers will be enrolled in this phase. During the phase 0.1, which should be implemented in March 2018, we will enroll individual dentists, dental groups, 1915I individuals, 1915I groups, federally qualified health centers, and ordering and referring providers. Phase 2 implementation, to be launched April 2018, will consist of the remaining provider types, including hospitals and other clinics, nursing facilities, and waiver providers. Keep in mind, the ordering and rendering providers refers to interns and residents only. So in preparation for the implementation, there were a few business practices that stopped prior to the ePREP go live. Effective October 23rd, 2017, the Maryland Department of Health placed an enrollment hold on providers included in Phase 1. Those providers may continue to use other eMedicaid functions, including your remittance advice, the EVS system, of course, and claims submissions, among other Medicaid functions. Maryland Department of Health staff will direct enrollment-related calls from Phase 1 providers to Automated Health Systems Provider Enrollment Helpline. And I'll share that number with you later in the presentation. Next. The following list applies to individual rendering or solo practitioners as well as groups. So if you know, some of the providers included are physicians, of course, which I alluded to earlier, psychologists, optometrists and opticians, nurse practitioners, and applied behavior analysts. 1.1 providers are those individual dentists that we spoke of earlier, the dental groups, 1915I individuals and groups, which is intensive behavioral health services for children, youth, and families, ordering, referring, and prescribing providers, and federally qualified health centers, also known as FQHCs. This is a more comprehensive list of providers that will be required to use ePREP during Phase 2. So, of course, we will be enrolling the hospitals in the area, ambulatory surgery centers, labs, pharmacies, urgent care centers. The Phase 1 go live represents roughly 80% of the entire Medicaid provider population, or about 50,000 providers. The Phase 2 go live represents roughly 20% of the entire Medicaid provider population, or about 14,000 providers. Now I'll turn this portion of the presentation over to Alan. He'll discuss the 3 concepts that we'll be discussing throughout the presentation. Alan?
Thank you, Tracy. So one of the things that we need to keep in mind is that we have certain terminology that will be used that's new to you. So We have three key concepts that we want to make sure that you are aware of, because these concepts or this terminology will be used whenever you use ePREP. So for example, we have a terminology of user profile, business profile, and provider accounts. And I'll talk about each one of those individually. Next. So the user profile is much like your LinkedIn or Facebook page, where you need to create an account. ePREP portal is designed so that you'll need to verify who you are when you log in. And so in order to do this and to become a member of the ePREP portal, you need to have a user profile. This user profile will be created, and Tracy will talk about how to create that later. And once it's created, then you'll be able to access your business profile, which is what I'll talk about next. So the business profile is where all of your organization's information centrally located in a secure environment. This is where we will be able to house all of your applications and also your provider accounts, which we'll talk about in just a minute. One of the things to keep in mind is that the business profile at a minimum is based on the tax ID. And there's a reason for that, and that's because, as you know, with the Affordable Care Act, we've been required to submit additional information about your organization, and that information is at the tax ID level, and that is why the business profile needs to be at least created based on a tax ID. Now, you can have one or more business profiles depending on your organization and the way it's been set up. The provider accounts, this is a new concept. You submit today a paper application. You send it into the state takes that application and they review it, and then they approve it. If they approve it, then it becomes a file or a record within their system. But that information is unknown to you. All you have is the paper application in order to go out and make changes. So for example, let's say that you decide that you want to make a change to the organization's bylaws. So in order for you to apply it to the state, you will need to submit a supplemental application. Well, you're not sure if the state received that information or whether that information is correct. So it's hard for you to be able to go out and see what the state has on record for your organization. What we've done is we now expose all of the information that the state has on record for your organization through a provider account. Now, account is made up of an MPI, provider type, and location. If any one of those three elements changes, then you actually create a new provider account. Also, you may understand that the MA number, every time you have a new account, you'll receive a new MA number. So just kind of give you an example. Let me go ahead and explain a little bit, give you an analogy. Let's say that you're at a bank and you want to have a checking account at a particular bank or a savings account. You need to fill out a form or an application in order for you to receive that saving or checking account. Now, you decide that once you receive that, once it gets to the bank and they go ahead and set up your account, you get a number. Well, all provider accounts will have their own unique ID. Once you've set up that account, then you can go ahead and apply for a loan, let's say, for maybe a car or for a house through that bank. And so you have to fill out another application in order for you to receive that loan. What happens is when the bank receives that application, it goes through a screening process or an underwriter, and they'll look at that application, make sure everything's in place and that your credit is good, and then they approve the loan. Once that loan is approved, then you'll receive a loan account. So when you go into your bank and you log in to your environment, you will actually see three different accounts. You'll see your checking account, your savings account, as well as your loan account. And that way you'll be able to now manage those accounts in a way that you want to manage it. It's the same way with the business profile. You log in, go into the business profile, and then you can see either one or more of all of your accounts that you have with the state. And that way you can then go in and see what information you need to change or update as your business or organization changes. I'll go ahead and turn the time back over to you, Tracy.
Thank you, Alan. So here we have our avatar, Lucy. She's your virtual assistant to guide you through the enrollment process. You can see her on the screen on the left. This is the first screen you will see every time you access the ePREP portal. Please note the different options at the top of the landing page. You can view bulletins, contact us, sign up, and of course, log in. Those new to ePREP system will need to click on the sign up button to create a user profile. So let's begin the sign up process. Now, let's talk about how to sign up, as Lucy, the virtual assistant, has directed for all new users using the portal. On the sign up screen, you'll need to input your demographic information. So your first name, your last name, phone number, email address, and password will be needed to create your account. Be sure to enter your email address that you want to use when accessing the portal. And after entering the password below, check the box to prove you're not a robot. If you've ever used CAPTCHA before, like Alan mentioned with Facebook, LinkedIn, any of those popular websites, just check all the images that apply in the window when it appears. Once you have completed the first page, you will be directed to the password recovery screen. In the event you need to reset your password, 3 security questions will appear. These questions will be used to help you recover that password. It is strongly recommended that you use a different recovery email address for your security protection. Here, the provider will enter a different email address below and will need to select 3 security questions and input an answer. These questions will prompt you in the event the password is forgotten. This should be an email you regularly use and that will stay with you during potential changes. So note the yellow box below. That's where you would input that recovery email address. Here's a list of the security questions that you will be asked. You will only be able to answer a question once for each of the 3 security questions. Once the sign-up is complete, an activation email will be sent to you. Follow the instructions in the email to complete the activation of your user profile. You must click on the ePREP portal activation link in blue. Please note that that hyperlink is only good for 30 days. Once that has been completed, you'll receive the sign-up verification screen. So you'll be asked to enter your password. Note here the username is already input. You will only need to input that password. When you've completed the activation, you'll be asked to input the password again. Once that is completed, you're now a member of the portal. The email address you used will be the username when logging on to ePREP. Now that you've logged in, you'll be prompted to create your organization's business profile. The business profile is designed to house all applications and accounts. ePREP allows you to create an account for your provider group or your organization. Provider accounts and provider records are now visible to the user and available to manage. Let's begin and set up a business profile. This is where you input the group's NPI on that screen. As you can see, after you input the NPI, Lucy appears once again with the hover help on the right with text to guide you through the process. Now, when you enter the NPI that you wanted or that you've selected associated within the business profile, billing and renderers will need to have a separate business profile. If your group is new to Maryland Medicaid, create a new business profile using the NPI. However, if your group is already enrolled in Maryland Medicaid, enter any NPI associated with that practice. Note, the system will perform a search for any existing business profiles or accounts. The current pop-up will expand, and if you note next to under the provider ID name, the existing business name will be input there. So it's expanded with the group name, and you're able to select that the box in blue and create the business profile.
So let me give you a little more insight there. Only time you will see the business name auto-populated is if you already have existing accounts in the Maryland Medicaid record or system.
Thank you, Al. Now let's link your business profile to your existing Maryland Medicaid account. You're required to answer 3 questions for verification, and you only have 3 chances to answer, or the system will time out after 30 minutes. Once the questions have been answered, the accounts have been successfully linked to the business profile. If you note, this is the screen with the 3 questions. You input your answer, and it's congratulating you that you've actually linked those accounts to the business profile. Now, after the accounts have been linked, Lucy appears once again, your virtual guide, to assist you through the enrollment process. Here, the welcome screen, we have several tools to access the portal and provide instruction and guidance as you navigate. So we have the Learning Center, which provides in-context tutorials for you to view. There are 3 to 5 minute videos that you may want to view when you're accessing different sections of the portal. You have the My Tools function, which I'll discuss later on in the application. You have the Message Center, the My Applications, and the My Account section, which is the provider accounts that we mentioned previously. Here we have the Message Center. In the Message Center, you can read, view, and send messages securely with the ePREP portal system. If you note at the top of the dashboard, we have Sandy. That's the persona we'll be using throughout the presentation, Sandy Jones. So this is Sandy Jones' email that we've referred to as a dashboard. If you look on the left, there are messages. You can view her messages. There's an inbox. You see the group name that we input earlier, Century Medical Group. She can check her sent messages. And there's a cool function that we also have in the portal. These are our collaborative tools where you can share applications within the portal across multiple lines. Here we have the address book. From the address book, it contains all users within the ePREP system. So once Sandy is set up this account, and if she wants someone else in the organization, or if she invites another person within the organization, this is where you can select those drop downs. Next, once again, here we have Sandy Jones in blue. Her name appears in a drop down. It's like any other typical email processing system. She can attach documents in there, compose her email, select files and attach them. And again, she could select a recipient to send a message to the members of the provider group and or organization. Here's also the guest email address. So when inviting certain providers who maybe are not a part of the group, she would actually input this user's email address and invite them to the portal. Now, here we have our business profile invite. Once in the business profile, you can invite users and change their privilege types, the members. Note here, Sandy Jones has the role of administrator. Reason being, she automatically became the administrator when she set up the business profile. Note her name here, her privilege type, administrator, and that she's active. To the far right is a button she will select to invite other users to become member of the profile. Here we have the Tools User Administration screen. This is a screen you'll see when you invite a user to join the group. So this is a screen that Sandy's in. This is a screen that she sees to invite a member. She will input the user's first name, their last name, and their email address. Keep in mind, this is an email address that the user will be using to access the portal. Note that she added Alan Colton as a user. If you see right here at the top right, Now Sandy can assign a role or privileges to Alan. There are various options that could be selected when creating a role. The roles available are administrator, manager, supervisor, authorized signatory, staff, user, and a guest. So now we'll note here again, Sandy created the role and she assigned a privilege type to Alan as administrator. In this function, the administrator can view all applications, sign for the provider, submit applications, view all accounts, make changes to accounts, view sensitive documents, send messages in the account, manage the profile, the document library, request active accounts, remove any MMIS originated accounts, which is a new feature, manage user privileges for the group, change the application owner, and as well as invited guests. Here we have the administrator screen. Sandy can assign Alan as an administrator, and here are some of the functions that he can operate as an administrator of the business profile. Here we have where Sandy assigned Alan manager privileges. His status is pending, and it will remain pending until Alan accepts the user privileges. Once the invite has been sent to the user, you will receive a notification inviting you to become a member of the portal. You will click on the ePREP portal activation link, and you will go through the proper workflow to sign up and create your user profile. This will then automatically take you to the business profile. Once your user profile is activated, you'll be taken to your group profile, asking you to accept or reject the privileges assigned. So this is what that email will look like. Your user invitation email from Sandy Jones to Alan Colton. And here is where you will accept or reject privileges. The purpose of the document library is that it is a centrally located repository used to store commonly used documents. It allows you to attach the same document across multiple locations so that you can only have to upload one time. You can upload your SDAT, bylaws, Maryland lab permit for your group or your practice. Keep in mind only the administrator has access. Here's where you'd upload the document. You'd provide the naming convention of the document, create a brief description, a title of the document, and a brief description. Here you see the document has been successfully loaded. Sandy uploaded the SDAT. That's the document name, the title of the document, and the date it was created. If you'd like additional assistance on the document library, please use our in-context tutorials. It's this film strip up in the left-hand side, upper left corner. And now I'll turn it over to Alan, and he'll discuss the applications within the portal system. Alan?
Thanks, Tracy. One of the main features within the ePREP portal is the applications. The applications are used to pass information to the state as to whether or not you want to enroll as a new provider, or you may want to enroll a new location, or you may want to update a specific account. And we'll talk a little bit further in detail around the provider accounts in further slides. Or you'll actually want to validate your account. So everything that is passed between the ePREP portal and to state is done through an application. An application does not mean that you receive approval right away. The application is a means to obtain approval. So we have the application here, as you can see. The first page that you'll come up is the Getting Started page. This page will explain further about the application and what its purposes are. So for example, I go through, I got a group billing. I'll have further information from an in-context tutorial about the group billing. I'll also be, as you can see here, I have the Getting Started in-context tutorial. The Getting Started in-context tutorial will give you further details around how to use and manage your application. Now, before we receive this application or this application is created, we actually go through questionnaire. Now, the reason why we bring up a questionnaire is that we want you to be able to fill out the correct information. As you know, in a paper application, you're unsure, or in most cases, you're unsure about what information is needed based on your organization. What we do within ePREP is ePREP allows you to go through a questionnaire to find out if you're a group or if you're you're individual or solo practitioner, or what provider type you have, your MPI, and also more details around if you're rendering provider. Let's say that you want to have an affiliation with a group. A rendering provider could also go through the questionnaire in order to affiliate with that group. Once you complete the questionnaire, then ePREP will look at your answers and then create the appropriate application based on the way you answered the questionnaire. In this case, we're a group billing provider, who is actually, it's a physician group. So you look and you see that we have, I talked about earlier, the Getting Started page. This Getting Started page, again, is to give you further information about this application. Now, let me explain about the application structure and the way that it's organized. First off, on the left-hand side, you will see that we have a navigation tree. This navigation tree is divided based on a social form, which we call business information, which contains subforms such as business profile, contact person, addresses, logistics. And each subform contains sections. Those sections contain the information that the state requires when you submit the application. Now, no longer are you going to be required to figure out on your own in the paper application as to what you need to supply the state or a type of documents that's being required. Each section will provide you with only the information that you must provide the state. If the information is not listed underneath the section, then you don't need to supply that information. Now, how do you know what's been completed and what hasn't been completed? You'll notice on the left-hand side of the tree that you have the various bubbles. One bubble is solid. That means that that social form has been completed. You also see the empty bubble, which says that no information has been entered into that social form or subforms. And also you'll notice along the top where the sections are, you will actually see they do not have any information contained in them either. Then you will see down at the Submit Applications a half circle. That half circle means that some information has been supplied, but you still need to complete certain sections or subforms. Along the top on the dashboard, which is what we call along the top, you have the provider name and you have also the provider type and application IDs. That is important, the application ID, so that if you ever are asked by the support team from the state, they will most likely ask you the application ID in order to give you further assistance. The next items that we see along the top of the dashboard is the 0% complete, or the 0% documents. The 0 complete is actually a progress bar that tells you how much of the application has been completed. The 0% documents tells you how many documents you've attached and also how the percentage is for the remaining documents. Both of those are very valuable in that they give you further information as to what has been completed and what hasn't. Now, documents will dynamically change that percentage on the documents progress bar. Depending on the question that you that's being asked of you and the way you answer it, you may or may not need further supporting documentation. If that's the case, then you may see that your percentage of documents started about 90%, but then once you answer the question, then the state is going to require additional supporting documents. So you'll see that that percentage will drop from 90% down below 90%. Now over to the right-hand side, you'll notice that there's the new message. The new message is actually part of the application. All messages that are sent from the application become part of that application. Now you can also use that new message to communicate with other members of your business profile, or you can communicate with the state. The submit, as you will see along the right side, is in red. And the reason for that is that if you notice, none of the application has been completed except for the getting started social form. And so once the application has been completed, then the submit button will turn to a blue and then also allow you to submit the application. Now along the right-hand side, you'll see that there's tools there. Those are our collaborative tools. The first icon allows you to actually print. But not only do you print the application itself, you can also print out social forms, subforms, or even sections. And that's useful in that you may want to show someone a particular section, and so you may want to walk over to their desk, which we call sneaker netting, and you'll be able to print out that section and then bring that information over to the individual and then write notes on it or however you want to, rather than having to print out the entire application. The next icon is the attachments. Now that's at the application attachments. We'll show you further how you'll associate an attachment to the field. But in this case, you may want to attach a supporting document for purposes of clarification to the application so that the state analyst will be able to look at that supporting information and make decisions around it. The next icon is the social chat. It's a very valuable tool because now I can put Post-its or sticky notes onto the application. If I'm collaborating, let's say I'm collaborating with another coworker, I can actually put a sticky note on here and ask the coworker to fill out certain sections or to maybe attach a document or whatever it may be. This gives you, it's a very valuable tool to be able to communicate back and forth. Now these social chats will not be sent to the state. The state does not see any of your social chats. So you can freely chat all you want, and once you submit the application, those chats will no longer be part of the application. The next item, or the next tool, is the share. The share tool, Sandy, let's say Sandy, she's the one that started this application. She automatically becomes the owner of the application. But in order for her to allow other members of her team or within her organization to edit the application, she must share it. So you will use the share feature in order to have other people collaborate with you on this application. So again, the owner of the application is the only one that can edit the application and also can only share the application. Once you share it to someone else, that person will not be able to share. They'll just be able to edit or manage the application based on that share criteria. You can also share the entire application, a social form, subform, or section. And that's very useful if you don't want other staff members to see other parts of the application. You can actually share, let's say, a social form. So when it is shared to that individual and they accept it, all they'll see is that social form. They won't see any other parts of the application. The next item is the messaging. Now we talked about the application message, but again, the messaging here allows you to narrow down the area that you want to send a message about. So in this case, you can send a message against a social form, subform, or section. The next icon or the next tool is the in-context help. Now this is a dynamic help. So if you're in a certain section and you see that in-context help appear, then you know that there's further information such as maybe state policies or something like that as far as what you need to fill out. If it's not there, that means that there isn't any context help available to you at this time. Another useful tool that we have, or actually tools throughout the product, is the field areas, where each field will allow you to, as you can see below where we say value is required, if you enter an incorrect value, then you'll get a red X, or incorrect number of characters, those kinds of things. But in this case, in this screen, what we're showing you is how we provide you with addresses so that you don't have to fill out all of the address information like you have with the paper application. As you know, with paper applications, you have to fill out a lot of address information and it becomes cumbersome. So in this case, what we do is we use the United Postal Service's database. So as you begin typing on the street, you'll notice that a drop-down will appear. This drop-down will actually show you addresses that you can choose from. Now, if your address isn't there as you're typing, don't worry, just continue typing the address and eventually it will show up in the drop-down. Off to the right-hand side of that field, we call that hover help. That's additional help that Lucy gives you in order for you to be able to fill out the correct information on that field. Now, as you notice, Lucy's at the top, and she'll be there on just about every single section, and she'll be able to give you instructions as to what the general idea of this section is. But this social help is additional information that Lucy provides you in order for you to be able to understand what values are required. You'll also see in there that you have 3 other social tools. One's a chat, which looks like the one that's outside on the right-hand side, and you'll also see the explanations, and you'll also see attachments. Now, that attachment is actually part of the field. So when you attach something, it is attached to that field. Social chat actually is you use that for, let's say that you want to have someone fill out a specific information on a specific field. That social chat will be then tied to that field. Just like before, when we go in and use the social chat against the social form, subform, or section, that social chat will also be used the same way for fields. The explanation tool allows you to explain why you answered questions the way you did within the application. Now, this explanation will go to the state because it's a way of letting the analyst know why that information is there and what the purpose is. Let me give you an example. Let's say that we have a married couple. In many cases, the woman will take on the man's last name. And so what she has to do is she has to go through all of the changing of her documents or IDs and all that kind of stuff. And so you can actually put in here an explanation as to why her name is different than what the state sees on various databases that they go out and check. And so you can explain that she got married on this date and her name is now Smith and it used to be Hamilton. And so by knowing that, the analyst is going to be able to see that maybe the records that are out there haven't been updated that they have on their database, and her name is Hamilton, whereas it now is Smith. One of the valuable pieces within the application is the Lucy checklist. This is very important in that as you're filling out the application, a lot of times we'll watch and see providers making a paper checklist to make sure that they've captured everything and put it onto the paper application. And so in this case, what we're doing is we're providing you with that checklist based on what you've answered and what you haven't. So in this case, we have the document attachments. Again, like I said earlier, these attachments are dynamic. So when you see that the checklist is not completely filled out, it actually will show you red X's. But once you attach that document, it becomes a green check mark. The applications list, what this is this is all the social forms, subforms, and sections. as to what has been completed. And you'll see again, like you say, the green check mark and then the red X. Those will be the same symbols used in the document attachments. Now, if you want to go and click on one of those red X, the title of one of those red X's to make the change or to add information, then you can just click on the title, or you can click on the pencil off to the right-hand side and quickly be taken to that section or social form or subform. So finally, once you get the application completed, once it's been filled out, all the attachments are there, you can then, now what we're doing is we allow you to sign electronically. No longer are you required to put in a wet signature, as I call it, handwritten signature. You can now electronically sign the application, and it'll still be legally binding in the courts in Maryland. But what you see here is that it shows that Sandy's not allowed to sign. We have certain rules that we put into place based on the state regulations as to who can sign the application and who can't. And since Sandy doesn't meet those guidelines, we give you a restriction page. On this restriction page, you will then see the instructions that are bulleted out as to how or what is required for you to become an authorized signer. Now, this does not eliminate the need for you to be legally allowed from the state of Maryland, but it tells you some of the rules that need to be in place in order for you to have the ability to sign. Now, I've gone in and I've changed Sandy so that she has met all of the criteria or all the rules that we've required in order for her to sign. And this is just an example of what you will see when you are authorized to sign. So in this case, Sandy, being under the group, she now is authorized to come in and sign the application because she meets all of the rules that we've applied into the system. She'll actually answer certain declaration questions, and then she'll also go on to the e-signature section, which will be more information about her and what she needs to fill out. So now that we've talked about the application, once we submit the application and it gets approved by the state, then an account gets created. This is where you gain information about your accounts. This was the part that I was talking about earlier about how you now are provided with transparency as to what the state has or the information that the state has on your organization. This is a valuable tool in order for you to go in and manage that information about your organization. Now, when I click on the little I off to the right-hand side on the actions next to each of the accounts, I'll be able to bring up the account viewer. Account viewer is actually organized similar to how an application is organized. But you'll also see along the top, the dashboard has changed from the application. It's now a different dashboard. Reason being is that now I have an unique account ID. I also have an MA number, as you can see above. And I also have the approval date showing to me as to when I was approved and this account was approved. Well, this account is up for revalidation. And so you'll actually receive a notification that will tell you that the account is up for revalidation when you select the account viewer. Along the left-hand side, you'll also see that we have the social form, subforms, and sections based on how the application was laid out. Now, on the right-hand side, you'll see that we have business profile and then the 10 SDAT. Now, that's the summary page on the application. So we're just showing you the summary of the information, but if you want to, you can go in and actually update that information. So by clicking on the update accounts, you will be able to see or be able to update this account or certain information about this account. A pop-up will appear where it is now organized as to what you can and can't change on the account. So in this case, it brings you up to the licenses certificates. So we can go in here and we can change the specialty, the professional license or certificates, your taxonomy codes, and in this case, the CLIA certification, because that's part of the group's application. Now I can select those three options and then select Apply Changes. And what will happen is rather than using the paper application and just filling out parts of it and then checking the box at the top and says this is an update, the analyst will now know what information you are changing. And so they won't have to dig through the paper application to figure it out. So when I go in and I do the Apply Changes, this new application will get created that we call a supplemental application. And only thing that will be present in that supplemental application are those data elements that you detect on this pop-up. So like if I check specialty taxonomy code and CLIA, I'll actually only see the subforms, social forms, subforms, and sections related to those three. And then I'll be able to fill it out and then go through the same process of signing the application and passing it on to the state. Now, you'll notice also along the top, if you decide that you no longer want to be a part of the Maryland Medicaid program, then you can go ahead and disenroll yourself from the program. Or maybe you decide that there was one site that you're closing down, and so you want to go ahead and disenroll that account. So you can go up and you can click on the disenrollment link, and a pop-up will appear and ask you, are you really wanting to do a disenrollment? This is a safeguard. So what happens is that sometimes you'll get clicking around and playing with things, and then you hit something, and we want to prevent you from doing that, an accidental click, and this gives you the opportunity to dismiss your click. But at the same time, like I said earlier, we use an application in order to pass the information to the state. Once I click on the disenrollment option, we bring up a pop-up asking you if you really intend to disenroll from the Medicaid program. Now, this is a safeguard so that if you decide that you actually, if you go through and you start clicking and playing with things and you click on something that you shouldn't have, such as the disenrollment, this gives you the option to dismiss that click and no longer will disenroll. But let's say you click on the yes option. An application will appear that will be called a disenrollment application that you'll need to then sign and send to the state. Like we said earlier, anything that you need to send to the state or disclose to the state must be done through an application. That's why we have a disenrollment application, and also why you will have to electronically sign that application. One of the things that we've changed, or that the state has changed, is the way you affiliate with your rendering providers. You'll notice here on this screen, down in the other box, down at the lower bottom box, you'll see that you have account history and account affiliations. On the account affiliations, you'll see all of the rendering providers that are affiliated with your group. Now, if you don't have the providers listed there, then it's one is it may have not have disclosed it, or even if you have disclosed it, the state just may not have it on record. So you'll need to do an add affiliation. This add affiliation will then bring up a rendering application in order for you to be able to affiliate with that provider. Now, if that provider is a new rendering, meaning it's new to the Medicaid program and new to your group, then you will receive a new rendering application. And we determine that, ePREP actually determines that based on the MPI of the provider. Now, if that provider is an active rendering provider in the Medicaid program, then you will actually receive a Rendering S application. That Rendering S application is designed to only require the rendering provider to sign the application as well as just the group. Now, there's two signatures involved with the affiliation application, and the reason being is that it allows both parties, the group and the rendering provider, to agree to the affiliation. In the past, it only took one party, but then the state was unsure as to if both parties were in agreement. Another nice thing about the affiliations is that now, based on each account, you can go in and manage and see all of the rendering providers that render services at a given location. This is very valuable in that it allows you to then also make changes if you need to on that rendering provider. So if you have a rendering provider that their information has changed, even though that rendering provider has their own business profile, and I want to stress, we need to make sure that each rendering provider has their own business profile, then you can still go in and fill out a change to their application and then have the rendering provider sign it and submit it to the state. But let's say that that provider, and this is the reason why we have a different business profile for that rendering application. Let's say that rendering provider or you decide that you no longer want to be affiliated with each other. You can click on the trash can down below, and that trash can will bring up a pop-up that will ask if you want to disaffiliate this provider. Now, both parties, the rendering provider from his own personal business profile as well as the group, they can trigger the disaffiliation. In this case, we have the pop-up that comes up again as a safeguard, so that if you decide that, hey, I didn't mean to click that box, I can always select no. But once I select yes, then you will have a disaffiliation application where you will be required to sign and then send to the state. Tracy, I give this all back to you.
Thank you, Alan. So if any of the providers or anyone over the phone have any questions over the next few weeks, we'd like you to visit the following resources. For additional updates, you can go to the state's website at health.maryland.gov/ePREP, or contact our Provider Service Enrollment Unit, our call center, at 844-4MD-PROV. That's 844-463-7768. They're open Monday through Friday from 7 a.m. to 7 p.m., except for state holidays in which our offices are closed.